Hi there, my name's Lauren Ives and I'm a final year medical student at the University of Nottingham. Welcome to my presentation evaluating the impact of patient age, BMI and AP uterine diameter on the risk of perioperative complications and total laparoscopic hysterectomies. Please feel free to pause the presentation at any point to review the graphics further. I hope you enjoy this presentation. The rise of total laparoscopic hysterectomies has been seen nationwide due to the widespread reporting of the benefits of the less invasive laparoscopic approach compared to the abdominal approach. These benefits include quicker recovery times, shorter hospital stays, reduced pain, and minimal scarring. Royal Derby Hospital, where this study is based, is a leading centre for total laparoscopic hysterectomies, performing one of the highest rates of the operation in the UK. The aim of this research was to assess if patient factors such as BMI, age, and AP fundal diameter influence the rate of operative complications both intraoperatively and postoperatively. All patients undergoing a total laparoscopic hysterectomy under the care of a single surgeon at a large UK cancer centre between August 2008 and October 2020 were identified. This was a total of 593 patients. This was done to eliminate any inter-surgeon bias during analysis. The electronic care records and operation notes were then reviewed for said patients, identifying occurrence of intra- and post-operative complications. Patients were then grouped based on their age, BMI, and uterine AP diameter, and complication rates were then compared using univariate analysis and setting a p-value of less than 0.05 being significant. Complications identified during the data collection process were classified as either intraoperative or postoperative. Intraoperative complications of note were bladder injury, bowel injury, and any intraoperative bleeding greater than 500 millilitres. Postoperative complications of note were bleeding, infection, readmission, GAU attendance, and return to theatre. Now to look specifically at age. Rates of perioperative complications were 26.3% in all those patients aged below 70 and 27.6% in those aged above 70. When looking at the impact of age specifically on intraoperative complication rates, you can see that as age increases, the percentage of cases experiencing intraoperative complications does increase, with just over 12% of the 80 to 89 age group experiencing them, compared to only 3% in the 40 to 49 age group. This difference was found to be statistically significant when comparing those aged above and below 70, with a p-value of 0.04. Postoperative complication rates between different age groups saw no specific trend. In fact, the highest complication rate was seen in the 40 to 49 age group at around 30%. When comparing the groups aged above and below 70, no statistically significant difference in postoperative complication rates was seen. Now to compare the rates of perioperative complications in total laparoscopic hysterectomies between different BMI groups. Unfortunately, in our data set, a large number of BMI values were missing from the data, so for this subgroup analysis we have excluded said patients. The number of patients analysed in this group was 401. This graphic displays both the intra- and postoperative complication rates in different BMI groups. Intraoperative complications are in blue and postoperative complications are in orange. Starting with the intraoperative complication rates, they remain less than 10% across all BMI groups. They did seem to steadily increase as BMI increased, however when comparing the rates between those with a BMI less than 30 and those with a BMI greater than 30, no statistically significant difference was seen. Postoperatively, the highest rate was seen in the underweight category, but this is likely due to the small number of cases in this subgroup. The rest of the group's complication rate postoperatively ranged between 20 and 25%, with the highest being seen in the morbidly obese group at around 25%. Again, no statistically significant difference was seen when comparing those with a BMI less than 30 with those with a BMI greater than 30. Now to look at the impact of AP fundal diameter on the rate of perioperative complications in total laparoscopic hysterectomies. Now to look at the relationship between AP uterine diameter and the rate of complications both intraoperatively and postoperatively. Unfortunately, again, a large chunk of AP diameters were not recorded, so this was just done based on what data was available to us. In total, 371 measurements were available, which is only 63% of all cases. For the purposes of this analysis, we defined a normal AP diameter of 30 to 50 mm. This table displays the raw number of complications for each size category. The highest complication rate intraoperatively was seen in those with a small AP fundal diameter, but this could be skewed by the small number of patients falling into this category. Those with an enlarged diameter did have a higher intraoperative complication rate than those who sat in the normal category, 9.4% compared to 5.6% respectively. but this difference was found not to be statistically significant. Post-operatively, the highest complication rate was seen in those with a normal AP fundal diameter, with 27.3% of those patients having complications post-operatively. Again, no statistically significant difference was found when comparing the rates post-operatively between the different groups. So some final conclusions from this analysis. Increasing age significantly increases the rate of intraoperative complications in patients undergoing total laparoscopic hysterectomies. This understanding aids patient counselling, decision-making, and highlights the importance of careful preoperative assessment for fitness for surgery. Whilst our results did not show any significant difference attributed to BMI, this may reflect significant surgeon-specific experience in advanced laparoscopic surgery. This analysis successfully demonstrated the feasibility of total laparoscopic hysterectomies in the context of an enlarged uterus, and proved that it does not significantly increase the rate of complications, suggesting that the option of a minimally invasive approach should not be discounted if AP fundal diameter does exceed 50 mm. Thank you for listening to my presentation, and I'm happy to take any questions.